Occipital bone is an unpaired cranial bone. It is one in number. It is located on the posterior aspect of the skull and the base of the skull. The squamous part is a flat type of a flat bone. It has three parts: the squamous part, the condylar part, and the basilar part. The squamous part has two surfaces. One is the external surface and another one is the internal surface. The internal surface is concave, whereas the external surface is convex, and it has four borders: the two lambdoid border and the two mastoid border. The lambdoid border articulates with the parietal bone, forming the lambdoid suture. It is denticulated. The mastoid border articulates with the mastoid process of the temporal bone. It has three angles: one superior angle and two lateral angles. Superior angle is the meeting place in between the sagittal suture and the lambdoid suture. That area is called as lambda. Features of the external surface are: it has a median external occipital protuberance. The highest point on the median external occipital protuberance is called as inion. Below the external occipital protuberance, there is a crust called as external occipital crust. And on both the sides of the external occipital protuberance and the external occipital crust, there are three pairs of nuchal lines. One is called as the highest nuchal line, another one is called as the superior nuchal line, and another one is called as the inferior nuchal line. Importance of the external occipital protuberance is: on the inner aspect, the superior sagittal sinus, located in the dura mater, ends and continues as the transverse sinus. Muscle attachments of the external surface are: trapezius muscle takes origin from the external occipital protuberance. Nuchal ligament is attached to the external occipital protuberance and the external occipital crust. It gives origin to the trapezius muscle. Highest nuchal line gives attachment to a aponeurosis called as galea aponeurotica. Superior nuchal line gives origin to the occipital belly of occipitofrontalis. Trapezius muscle also takes origin from the superior nuchal line. Sternocleidomastoid muscle is inserted to the superior nuchal line. Superior nuchal line also gives insertion to the splenius capitis. Area in between the superior nuchal line and inferior nuchal line gives insertion to the semispinalis capitis. Superior oblique capitis muscle is also inserted in the same area. Rectus capitis posterior minor is inserted to the inferior nuchal line. Rectus capitis posterior major is also inserted to the inferior nuchal line. Internal surface has following features: the internal occipital protuberance and the internal occipital crust, which divides into two to cover a fossa called as Vermian fossa. Above there is the sagittal sulcus and it lodges the sagittal sinus. On the sides there is the transverse sulcus. This transverse sulcus and the sagittal sulcus and the internal occipital crust divides the internal surface into four fossa: two cerebral fossa and two cerebellar fossa. The cerebral fossa is related with the occipital lobocerebrum. The cerebellar fossa is related with the cerebellum, and the Vermian fossa is related with the vermis part of the cerebellum. Sagittal sulcus lodges the sagittal sinus. On the margins of the sagittal sulcus, the falx cerebri is attached. And next, on the margins of the transverse sinus, the tentorium cerebelli is attached. To the internal occipital crust, the falx cerebelli is attached. In the internal occipital protuberance, there will be the confluence of the venous sinuses, the superior sagittal sinus from above, the straight sinus, the transverse sinus on the sides. Basilar part is located in the base of the skull. It has three surfaces: superior surface, inferior surface, and anterior surface. Superior surface forms the clivus. Anterior surface articulates with the body of the sphenoid bone. It has two lateral borders and they articulate with the petrous part of the temporal bone. In between the lateral border and the petrous part of the temporal bone, there is a inferior petrosal groove which lodges the inferior petrosal sinus. Basilar part also has a posterior border which forms the anterior margin of the foramen magnum. Superior surface forms the clivus where the brain stem rests. Superior surface gives attachment to the tectorial membrane, which is the continuation of the posterior longitudinal ligament. Deep to it, there is the attachment of the superior band of the cruciate ligament. Next, there will be attachment of the apical ligament from the odontoid process to the superior surface of the basilar part. Near the posterior margin of the superior surface, there will be attachment of the atlanto-occipital membrane. Inferior surface has a pharyngeal tubercle, gives attachment to the superior constrictor of pharynx and pharyngobasilar fascia. Inferior surface also gives attachment to rectus capitis anterior muscle. Condylar part has two occipital condyles, and above the occipital condyles there is a canal called as hypoglossal canal. Occipital condyles articulate with the kidney-shaped facet located in the lateral mass of the atlas, forming the atlanto-occipital joint. Hypoglossal canal transmits the hypoglossal nerve. Condylar part laterally has a process called as jugular process. The anterior part of the jugular process presents a notch called as jugular notch. The jugular notch, along with the petrous part of temporal bone, forms the jugular foramen, where the stick is present. Jugular foramina transmits the inferior petrosal sinus, which connects the cavernous sinus to the internal jugular vein. It also transmits the glossopharyngeal nerve, vagus nerve, and accessory nerve. The sigmoid sinus ends here and continues as the internal jugular vein. Foramen magnum is the largest foramina located in the skull. It is anteriorly bounded by the posterior border of the basilar part of the occipital bone. On the sides, it is bounded by the condylar part of the occipital bone. Posteriorly, it is bounded by the squamous part of the occipital bone. In the foramen magnum, the medulla oblongata ends and the spinal cord starts. The vertebral artery enters into the foramen magnum and the anterior spinal artery and posterior spinal artery emerges out from the foramen magnum. It also transmits the anterior spinal vein and the posterior spinal vein. The spinal root of the accessory nerve also passes through the foramen magnum, which joins with the cranial root. Regarding the applied aspects, fractures of the posterior cranial fossa can occur when a blow occurs on the posterior aspect of the head.